Launching a campaign for somebody in marketing at a health system is scary. What do I mean by that? You can get into trouble if you screw it up. And traditionally, the marketers were kind of working, and this still holds true today, they're working on behalf of other stakeholders like, oh, the service line leader for orthopedics or, primary care or other folks who, to be honest, have a lot more power in the organization. And so marketers are scared to screw it up. Also, it's complex because it's not only just like, do you have doctors available? There's often other kind of like operational aspects like, oh, if they don't have really great online scheduling for appointments, patients have to call the call center, and maybe the call center is really busy, and the call center is going to yell at them if they flood them with calls on one day. Mm-hmm. So I think that this explains a lot of the behavior that we haven't seen a high level of outreach in healthcare because it is so scary. And then the other thing we see is that the campaigns end. They have no way to kind of like keep them going, And so what really happens, the most common pattern we observe is they do a campaign around some kind of event. Like a classic one would be like October is Breast Cancer Awareness Month. So we're going to run the breast cancer campaign. And at the end of the month, it's going to end. And, for those people who might be at risk of breast cancer or due for a mammogram, the rest of the year, they're just on their own to like come in. We're not going to do any outreach to them.
Right.
So we can do much better. And we think, maybe this is bordering on hyperbolic, but I'm really excited about it. I think capacity sensing is sort of like the big unlock for healthcare marketing, kind of like the touchscreen was for the original iPhone. Like you used to have these attempts at smartphones, kind of flopped, never really took off, went mass market, until people Steve Jobs showed the right form factor and the big unlock, and it make them so much more usable. And people realize like, oh, these phones can do so much more. It's just the form factor and the touchscreen really like unlock that. Our sense is if we do the capacity sensing right, you make it so it's no longer scary to launch campaigns. In fact, that's one of our big objectives with our capacity sensing is to say it should never be scary to launch a campaign. It should always be safe. You should feel free to do that. And the system is just going to make sure that it does the right things, and it's not going to flood you. It's not going to have patients have a bad experience where, oh, we send them a text message to go make an appointment, and then they try to book it, and there's nothing available. So that should never happen. The capacity sensing, you should just make sure. And then the second piece, of course, is we never want these outreach programs to end. Like they should just keep going, and they should look at what patients are good candidates for these different products and services, and see what capacity is available, and just keep this going at the right level of outreach. So we think this is a huge, huge step forward for the whole industry and for our customers.